Thank you for the opportunity to be with you today. It's always a pleasure to speak with early career radiologists and a special opportunity to be with you at RSNA. We all regret that our annual opportunity to be together in Chicago had to be canceled because of the COVID epidemic, but we are looking forward to being together again next year in McCormick Center. My presentation is Radiology Demographics. Currently, I am serving as Associate Professor at Emory Department of Radiology. My disclosures are that I am also serving as Chair, Board of Chancellors, American College of Radiology, and also the Board Chair of the American Institute of Radiologic Pathology. I have no financial disclosures relevant to this presentation. First, I'd like to go over the radiology workforce as per the 2019 American College of Radiology Workforce Survey. The once robust solo practice of yesteryear is rare, a reflection of the collaboration and investment needed to provide modern medical imaging services. Single specialty practice partnerships or independent practice stand at 46%. It's noticeable that this is the first survey where that number has dipped below the 50% watermark. Multi-specialty practice partnerships such as Mayo, Geisinger, Layer, Ochsner Clinic, etc., are about 10% of the radiology workforce. As far as employment, those with hospital or hospital systems comprise 12%. 25% are in academia, which has been fairly consistent throughout the time span of our surveys. Government includes categories such as the military and Veterans Affairs, and less than 1%. And corporation stands at 6% according to the survey. Keep in mind that this was a self-identified survey. Those of us who study these trends feel like the corporation category is underrepresented and probably represent more along the order of 10%. This is a graphic of the changes over time in the different categories that we just discussed. There's been some variation year to year, some of which may be related to questions in the survey. Here's the distribution of radiologists by age, which has not significantly changed from 2012 to 2019. 7% are under the age of 35, 34% between 35 and 45 years old, 29% between 46 and 55, 22% between 56 and 65 years old, and 8% are over 65. Here's the current workforce gender distribution, with 23% of radiologists being female, 27% for radiologists under 35, 30% of radiologists in the age group between 35 and 45, 21% of radiologists between 46 and 55, 18% in the age group between 56 and 65, and 13% of radiologists over the age of 65. Just for reference, in the 1990-91 survey, 13% of all radiologists were female. We still have a ways to go to reach parity, but we are making some progress. Many have speculated about the reluctance or inability to attract more female trainees, but we continue to celebrate the role models and encourage women to consider radiology as a career. Full-time radiologists comprise 84% of our workforce. Here are some gender-specific numbers. 27% of practices reported that at least one radiologist went from full-time to part-time status during the time of the survey. As far as part-time radiologists, 68% of practices reported at least one part-time position. Overall, 16% of radiologists are part-time. This has been essentially unchanged since 2014. The three most common part-time specialties include breast, body, and neuroimaging. 11% of part-time physicians are male and 20% female. Some female-specific statistics. Again, for reference, in 1991, 7% of males and 16% of females radiologists worked part-time. As for retired radiologists, 14% of practices reported that at least one radiologist had retired. The overall number is somewhere between 150 and 200 grads. Of those retiring, 29% were part-time and 71% were full-time. 15% of groups reported previously retired radiologists were employed in some part-time capacity. I spent some time looking at the part-time and retired workforce statistics because this can have a significant impact on supply and demand dynamics. As we'll discuss in future slides, demand is anticipated to continue to increase, especially those radiologists who receive an equity buyout or whose portfolios are adequately funded. Radiologists may opt out of full-time work, putting even more pressure on the supply side of the equation. Looking at the current workforce by specialty, body imaging is currently the most populous, with general, neuroradiology, and interventional radiology being next. Just a note about the generalist category. This has shown quite a bit of fluctuation during the times of the surveys. Please note that this is a self-directed survey, so some of this may be due to changes in descriptions of the terms from year to year, or even self-determined job descriptions that the definition of generalist changes. There's been some recent articles which have been more definitive about defining such categories. Looking at the percent of practices that are planned to hire in 2019, specifically the specialties that are most in demand include breast imaging, neuroradiology, interventional radiology, after hours radiologists, which is not quite a specialty, and also body imaging. Just a note of caution here. Personally, I would strongly urge that you not pursue a particular fellowship just on the basis of these statistics. You need to find your interests and your passion and go in that direction. In 2018, practices reported hiring between 722 and close to 1,600 radiologists. And in 2019, that number was between 829 and 1,828 radiologists. The job market had been robust, and every indication is that it will return to that norm. For newly hired radiologists, 26% moved from another job, while 39% were first-time hires. Of the first-time hires, 7% had no fellowship, and similarly, of the newly hired radiologists who moved from another job, 7% had no fellowship training. Trends by region. Both in 2018 and 2019, first was the South, then the Midwest, followed by the Southwest. Trends by practice type. 2019, 48% private practice, academia or university, 17%, and hospitals, 14%. The most important specialty needs or subspecialty needs of radiology groups in 2019, 16% selected breast imaging as one of the top three, 13% selected neuroradiology, and 12% selected interventional, while 11% selected musculoskeletal. This is the reported or perceived importance of fellowship training for radiology groups by specialty. The blue bars indicate the response that fellowship training was important. As you can see, for the vast majority, fellowship training was considered a priority. Some conclusions of the 2019 survey. Workforce needs may change depending on the retirement of senior group members. This may become very significant, especially since 8% of the workforce is greater than 65 years old and 22% between 56 and 65 years old. Also, the percent of female radiologists seem higher in the younger age group compared to older radiologists. This is an interesting slide. It indicates the average percent of time fellowship-trained radiologists spend in general radiology or outside their fellowship training. You can see that between 28% and 50% of the time was spent on studies outside of their specific fellowship category. The exception was part-time interventional radiology, presumably because these individuals were hired for a specific slot or purpose. These numbers underscore the need for a well-rounded educational experience. One of my keen interests is leadership in radiology, so I thought I'd spend some time talking about statistics for radiology leaders. Certainly, a dearth of female leadership, with 94% of practices reporting male leadership and 6% females. Of all male RADs, 17% were or are in some type of leadership position, and that number is 4% for female. The age distribution for radiologist leaders was 3% under 35, 24% between 35 and 45, between 45 and 55 is 39%, 56 to 65 is 27%, and over 65 years old at 7%. The next slide indicates the percent of time leaders spend in leadership responsibility. You can see that the most popular is the gray shaded part of the pie, which is between 11% and 20% of time. Approximately 30% of practice leaders reported their leadership time allocation is within that category. I'd like to spend some time talking about additional demographic trends. This comes from the American College of Radiology and the work that we did on the corporatization task force. We consulted with the healthcare firm Frost and Sullivan to gather some of these statistics. We can anticipate, at least in the intermediate term from the consumer end, that there's going to be an increasing demand for imaging services. This is due primarily to the aging baby boomer population maturing into Medicare beneficiaries who tend to have a higher rate of utilization for imaging services. As we're all recognizing, there's also an increased demand for access not only to our reports, but to services as well. As for radiology and radiologists, there's a continuing recognition of the importance of work-life balance as burnout becomes a recognized component of the medical profession. As we've discussed in previous slides, there's also a significant number of radiologists who are retiring, especially as the stock market recovers and work requirements increase, along with decreasing reimbursement. So at least for the intermediate term, it's anticipated that we're going to have a workforce shortage with demand for radiology services outstripping the supply of radiologists. As for expectations, we'll get to that in a few slides. This is a survey of private practice model changes. 41% of private practices have reported either discussing are having practice model changeover over the last 3 years. There's been a significant difference in responses according to practice size, with about 45% of smaller practices of less than 10 radiologists reporting some type of practice model change. 19% of more intermediate size groups between 11 and 20, with 36% of larger practices. There were some statistical differences between regions, with 54% of practices in the Midwest responding yes, compared to 25% in the Mid-Atlantic. I do want to highlight the first part of this graph. While there's been lots of discussion in the radiology press about consolidation, a large number of practices, 48% in this survey, report no change. These practices feel very comfortable in their current market situation. Many have done extensive due diligence and have elected to maintain their current market position. 17% reported mergers with other groups. 8% reported joining an alliance. 8% selling to a corporation or corporate structure, either private equity or public. And 3% as selling to a healthcare system. The most popular reasons for model change being service issues, financial issues, or outside pressure from hospitals and healthcare systems. Of those practices that did have a model change, 60% were neutral regarding the impact. Factors could include either promises related to acquisitions that were not realized versus the fears of and concerns of some being a part of a larger entity, which simply did not come to pass. Interesting responses to this survey, which queried about the benefits, autonomy, career path development, workloads, salary, stress, and job security. The vast majority of responses fell into this gray category of no change. In the context of model change, I do want to talk a bit about a survey that was sent to early career radiologists and published in September issue of JACR last year. When we look at early career radiologists and their attitudes when looking at potential private practice job opportunities, 83% have a preference for independent practice. This is a very significant, if not overwhelming number. When asked about interest in being part of the business or leadership of the radiology practice, 79% said yes. Clearly, this is a very engaged generation. Are you worried about the possibility of your future practice being sold? 72% were very concerned. Moving on, coverage for small and rural critical access hospitals. 56% of groups provide some sort of coverage. Coverage provided by teleradiology for about 21%, 27% on-site, and 46% being a combination of on-site and teleradiology. Switching gears to interventional radiology, a question related to practice needs, or will non-IR radiologists be needed to perform basic procedures? 74% of practices agreed that they need non-IR fellowship radiologists to help with at least minor interventions. 67% also agreed with the statement that the hospital contract is stabilized by the ability to provide IR services. A large number of practices are having challenges meeting the IR needs of their hospitals and also the needs of their referring physicians. 70% of respondents said that IR doctors have primary diagnostic responsibilities as well. 55% reported that IR docs participate in the diagnostic call. Percentage of time IRs spend in interventional work were as follows. For 0 to 25%, 18%, 26 to 50%, 24%, 51 to 75% is 20%, and greater than 75%, 38%. I also want to spend some time talking about non-physician providers or mid-levels because they've become a significant part of our workforce. 22% of groups currently employ radiology assistants, 36% nurse practitioners, and 41% physician assistants. This graph is reverse, so the left is 2019 statistics. You can see of those groups that do employ non-physician providers, most are in the physician assistants category. Mid-level hiring trends. Again, blue is those who plan to hire in 2019. You can see that there is a significant number of practices that plan to hire non-physician providers. I'd like to switch gears a bit and talk about COVID's impact on radiology, taking a look at the demographics perspective. There's been a number of articles that have been published talking about the significant impact that COVID had on radiology volumes. Here are some excerpts from one of those articles. Taking a look at volumes from January to April of 2020, there was a 28% decline in total imaging during that period, but the maximum decline occurred over the last week, which was 40%. The greatest declines were realized in outpatient setting with up to 88% of loss of volumes, and in the emergency departments of up to 46%. So if you take a look at the new job postings in the American College of Radiology Career Center, this green line is 2020. You can see the fairly precipitous drop in job postings as we went into the COVID epidemic. Since April, the number of job postings have somewhat recovered in a little bit of a sawtooth pattern, but a general upward trend. Taking a look at job views, or those people viewing jobs between January and September, over the course of several years, there's a big jump in 2020, as many practices either furloughed or let go of radiologists. The number of CVs viewed by employers showed a very robust job market before 2020. 2020 numbers have clearly dropped off. This is mostly due to the beginning of the year at the height of the pandemic. I fully expect the trend toward recovery as we finish out the year and going into 2021. There have also been impacts on radiology besides the numbers in the job market. For instance, this is a reference to teleradiology from the 2013 ACR task force paper. Teleradiologist was principally identified with those providing after-hours preliminary reports, mostly with telerad companies, which were defined as entities that employ teleradiologists and engage in the management of workflow and image distribution. Now, I submit to you that the definitions and perceptions of teleradiology have literally changed overnight because of COVID. During the pandemic, hospitals and practices wanted to limit exposures of their personnel and their radiologists. They emptied their hospitals as much as possible, and work was done from home. So many practices who were reluctant to have off-site radiology services adapted to this model quickly. Almost all radiology practices now have some form of internal teleradiology component. So our previous perceptions of teleradiology certainly have changed. This is a table from 2005 and represents changes that we've realized with teleradiology. I'll draw your attention to the column about 2/3 of the way to the right under the mean category. This is the mean percent of procedures involving teleradiology. You can see that the vast majority of these are in single digits. Certainly, those numbers, if measured today, are multiples higher. I also wanted to spend some time today talking about radiology as a career. Think of your training in radiology as a platform, a foundation, if you will. Admittedly, the vast majority of trainees go into clinical radiology and enjoy full and rewarding careers. But if we think outside the box a bit, there's a world of alternative options out there that become available to you. People like McKinley Glover, Khan Siddiqui, Keith Dreher, Dave Prologo, Sanjay Shetty, Paul Berger, Paul Chang, and many others. Possibilities include IT, teleradiology, 3D labs, PACS, scanners, new modalities, molecular imaging, interventions, consultations, just to name a few more conventional avenues. Unfortunately, I don't have statistics about radiologists working in non-clinical or non-traditional positions, but there are many role models out there, and importantly, many opportunities for you. If this sounds attractive, I urge you to pursue your passion. Our training puts us on the cutting edge of medicine and medical imaging. While most dedicate ourselves to patient care, there are multiple avenues to express that dedication with current opportunities and those that have yet to be developed. In conclusion, radiology job market has historically been resilient. My mentors felt that Medicare was going to be the end of radiology. During my career, we have survived, if not thrived, through multiple legislative challenges, reimbursement cuts, self-referral, and now E&M revaluations. Radiology continues to be successful, and the radiology job market is robust. Be assured that you've chosen a special career path that will provide you with multiple career opportunities. There's an increasing and persistent shift in consolidation and corporatization in practices as radiologists look to position themselves for evolving healthcare paradigms. Early career radiologists highly value independent practice and want to be involved in practice development and management. Non-physician providers are becoming more prevalent, developing a more prevalent role in our radiology practices. And COVID has had a significant impact on radiology, but our volumes are rebounding. And finally, radiology provides multiple career pathways and opportunities for you to explore. So thank you for this opportunity to be with you today. I want to leave you with this poem from an Irish poet, that everything is going to be all right. And finally, thank you for this opportunity. I look forward to our question and answer sessions and being together again next year in Chicago.